While the COVID-19 pandemic appears to be slowing in momentum in many parts of the World Health Organization says a record spike of 307,000 cases have been reported around the world in the last 24 hours.
India, Brazil and the US still have the most number of cases. Britain, Austria, France and the Czech Republic are seeing a second major spike.
More than 29 million cases have now been confirmed since the start of the pandemic. More than 900,000 people have died and 19 million have recovered.
While South Africa continues to move down the list of countries most affected by the virus, it's now 8th on that list.
It's been 192 days, or more than 6 months, since our first confirmed case.
Almost 89% of people who acquired the virus are reported to have recovered. More than 15,000 have died.
In the last 24 hours, another 20 people have lost their lives. It's the lowest number in a 24-hour period in several weeks.
So, if you've had no symptoms of COVID-19, is it useful to take an antibody test? Malan is the editor of the Bhekisisa Center for Health Journalism, and she's got some options that you could explore. Mia, good evening, and thank you so much for your time on the Pulse tonight. Firstly, let's talk about these antibody tests, right, and what they're able to tell us about COVID-19, especially for individuals who might be curious just to know whether or not they've ever had the virus, or if they have so-called immunity to COVID-19.
Yes, so you've asked two questions here. The one is, can we use an antibody test to diagnose someone with COVID? And if not, what are they useful for? So the answer to whether you can use an antibody test to diagnose someone is generally no, but it's not a straightforward answer because it depends on how long your body takes to produce SARS-CoV-2 antibodies and how soon after infection you're taking an antibody test. So there are different types of antibodies that our body produce, and they tell us different things. So most COVID antibody tests look for two types of antibodies: IgM antibodies that develop within a few days after infection but that eventually disappear, and IgG antibodies that take longer to develop but they remain in our body for much longer. So if you take an IgM antibody test at the right time, in other words, if you take it long enough after infection so that your body has had the time to produce IgM antibodies, but before they disappear, then a positive result will tell you that you infected at the time of the test. But it's a very unlikely scenario because it's so hard to get that timing right. So the question then is, what can you use these tests for? Now, antibody tests are far more useful when they detect the IgG antibodies that stay in our bodies for much longer after infection. So if we, for instance, want to know what proportion of people in a certain area has had COVID, then we can use IgG antibodies to tell us, and we've done that in South Africa, in Cape Town. We have done an antibody survey that we looked at a certain sample of public health users that told us that 40% of those users in the Cape Town metro areas have had COVID, which is a much higher figure than what we would have measured with PCR positive tests over the past period.
Mia, what does this kind of data do, especially in trying to help medical practitioners understand the situation that South Africa is in, where the numbers that we have had have not been as bad as was expected or even anticipated?
Well, it hasn't been as bad as we expected, but what we don't know without antibody tests is in reality how many people have had COVID. So antibody tests, by going backwards and measuring how many people have IgG antibodies, it can tell us the real number of the people who have had COVID. Whereas if we just used PCR tests that detect genetic pieces of the virus, we won't detect all of it because we know that 80% of people who have COVID don't go for PCR tests because they simply don't feel sick enough. So we don't get to test everyone. Now, what does that data tell us? So we can measure it to see how has the virus spread. We will, for instance, be able to see, has it been worse in city areas as opposed to rural areas, and it will tell us really how many people have been infected.
Mia, are we likely to see studies and research now undertaken that, of course, can apply to the entire country, where conclusions can be made around COVID positive tests in the entire country when it comes to these antibody tests, rather?
So what often happens with antibody tests is if there's, for instance, say if we see a second surge and there's, for instance, a hotspot area, and scientists want to see how quickly is the virus spreading there, or where might it go to, then we can use antibody surveys for that. But we can also use the antibody tests if you, for instance, live in a household and there was someone with COVID or you don't know if people have had COVID in your household, just to see if you have contracted it. And if you then do that, it's very important to remember that if you have a positive antibody test, it doesn't mean that you're immune against COVID, because we don't yet know if we know that there's some form of short-term immunity, but we don't know for how long it lasts. Because you may recall recently we heard about a man in Hong Kong who contracted the coronavirus for a second time, and that second time happened within 4.5 months of the first infection. So scientists have pointed out that reinfection with coronaviruses is not new. Many common colds are caused by coronaviruses, and we get reinfected over and over. But what they do suspect and still need to prove is that the second or third infection will not be as bad as the first infection, because our bodies would have built up a memory of how to quickly produce antibodies for the new coronavirus.